This is the Fix Your Sciatica podcast.
All right, and we're back. We are going to be taking a break from the movement breakdowns that I've been producing for you guys for the past couple weeks, and it's been a while since we've actually had a guest on the show. I often have guests either talk about their experience with sciatica, or the other piece is actually like interviewing a professional who knows another tool that I'm not necessarily well versed at. So today we're going to be discussing Pilates specifically. It's a philosophy that I find a lot of value in, but I just don't have the bandwidth and to take on a new modality and concentration such as Pilates. And so today I have a good friend. Her name is Kathleen McDonough. She's an MAPT. She's a physical therapist out in Marin, just like I am. And she was really kind enough to share her expertise and her take on using Pilates as a way to recover from injury, but then specifically for you listeners, how it approaches to sciatica. So Kathleen, thank you so much for being on today's episode. It's so good to see you.
Thanks for having me. It's very exciting, and I'm really happy to talk about this stuff and to share my love and passion about Pilates, specifically with regard to sciatica with you and with your podcastees. So
yeah, and I mean it's really such an honor because you have such great experience. We had the opportunity to meet a couple weeks ago, and it was really fantastic to learn about your philosophy. And after hearing you, I was like, I got to interview you so people know more, because I find that the more knowledge that people have, the more that they're actually able to take care of themselves, because there's so much out there. And I remember from the beginning when I started this podcast, my goal was to say, let's be better than just Dr. Google. Let's give some people some direct and understanding what could be really helpful for them, right? And so for starters, tell us a little bit more, let's do a little quick rundown of your career, especially how it led to Pilates.
Yes, so when I was in grad school, we had a final project that we could design our last internship, and I wanted to work with ballet dancers. And so I went to New York and worked with Marika Molnar, who was a PT, who was the first one that was in a treatment clinic. It was really just a somewhat small room at the theater in New York. And so I went and worked with her, and she said, if you're going to work with dancers, you got to know about Pilates. And so she took me to the studio that the ballet company went to, a lot of the company members went to, and it was just crazy. They were like these spiders just, doing crazy things. And I thought, well, that's really interesting, and I'd like to know more about it. And I could never do that. And then flash forward to about mid-'80s, and I was working at my second job at St. Francis Center for Sports Medicine and Dance Medicine. I worked with with San Francisco Ballet Company, and we had Pilates as part of rehabilitation. And I had an injury. I ended up doing aerobics on a crappy floor with not great shoes and ripped off about 4 inches of my posterior tib tendon, and I couldn't do anything, athletically for about, 4 to 6 months, but I could do Pilates. And so that's how I got to experience it in my body a little bit and see how it was used more in a rehab sense. Back then, there were no specific teacher training programs. You would go and sit at the foot of somebody who is an experienced teacher, and you'd watch and you'd take notes and you'd take lessons and classes, and after a while they'd bless you and say, okay, now you can go and do Pilates, but there was no official teacher training. And really at that point I understood Pilates as an exercise modality and did not really understand it as a method, as a complete treatment method or philosophy of treatment. And I always wondered, if you look at, there's this little book called Return to Life that Joseph Pilates wrote way back when in like 1944 or something. And he goes through the 34 mat exercises, modifications or precautions about who should do what, and just like, okay, everybody could jump in and do these. And it's very flexion loaded. So of the 34, the beginning is a lot of flexion. And as a PT, I was seeing a lot of people that couldn't do a lot of lumbar flexion because of back injuries. So I was like, what was he thinking? Why did this guy, who clearly thought very deeply about health and happiness and wellness and this sort of mind, body, spirit, wholeness, why did he have this this sequence this way. And so I went back and did a comprehensive teacher training program in Boulder with Amy and Rachel, the sisters who started that program. They had learned from a woman who had learned from Joseph Pilates and was sort of the person who carried on, one of the people who carried on his method. And it was a long program. It was 1,000 hours, and it took me a year to complete, but you had to really experience it in your body and understand it in your head and understand the anatomy behind it. And it really just blew my mind about this method is something that is life-changing. Really, for me it was. At that point, I'd worked at St. Mary's Spine Center for about 10 years and working with horrible, terrible backs, sometimes multiple failed back surgeries. So teaching people to not move their spine, like you're going to squat, you're going to straight back bend, you're not going to move your spine. For you, you may not ever be able to move your spine. And so my spine was really stiff. And I had a baby, and it was hard. It's hard to push out a baby with a really stiff spine, right? So going through the comprehensive teacher training program changed my body, changed my philosophy from more of a PT focus about, don't do this, don't do that, don't do this, to what's possible. How can we make this possible for somebody? What's the potential in every human body? How do I teach somebody with the appreciation that any body could go from 0 to infinity and beyond without disturbing their symptoms? They may not get there, but if we teach with that sort of open-mindedness, I think it really benefits the client. It also makes your teaching experience more rich. So that's how I came to Pilates and just fell in love with doing it and still do it and still take classes and lessons. And people say, you take a lesson? What? You could just do it, right? It's like, yeah, but you need a teacher. You need somebody to watch and help you grow and keep getting better or feeling different things in your body. So that's it in a nutshell. And my PT practice, pretty much people seek me out because they're looking to do Pilates and they're uncertain about it, or they have questions about an old injury and they want to start with a PT who understands the method as well. So while I think that there are Pilates teachers that can absolutely do that for people, the people who see me tend to want to just say, I feel more comfortable starting with a PT who's also incorporating Pilates. So I incorporate Pilates into pretty much every treatment plan.
I love that. And thank you so much for sharing. It gives us a nice deep dive into like why or where you came from and like why you do what you do now. What's really interesting, you bring up the Pilates method, and what's interesting is that when I think Pilates, I think like Matt Pilates reformer, but that's kind of like the extent of it. And I know that there's a lot of benefits to it. And usually with the method, there is a philosophy behind why the method works or how it actually works, right? And so we look back at even just like the McKenzie method, for example. The McKenzie method is often actually, unfortunately, kind of bastardized because people always perceive McKenzie method as really just back bends and low back extensions, right? But the truth is that McKenzie, his big focus, just like Jeffrey Maitland and his philosophy, was the patient is going to tell you exactly what that person needs in front of you. Their response to a specific movement will then drive your ongoing treatment, which for McKenzie, he popularized back extensions because he accidentally found that back extensions were helpful for some people. And so here you have the Pilates, which, as you said, it seems a little bit more flexion-based, but I would love to hear a little bit more about your interpretation of the philosophy behind it. Because they're like, here are these exercises, but like why? Or like why are these so important?
Yeah, so I would recommend this little book, and actually the National Pilates Certification Program just put out a new version of it with some video with it. There's an intro at the beginning that's only like, 8 pages long or something, and German was his first language, so the language is a little bit flowery sometimes, or a little bit funny, but really, and I was just looking this over today before joining you, and I was thinking back to our conversation about what you do and what you try to empower people with, and that's resilience. And he was really about this, like, how many of us at the end of our daily work lack sufficient energy at night for recreation? How does taking care of your body, mind, and spirit help you be a happier person? And that was he really felt like if everybody did his exercises, that my sound mind could tell my body what to do, my body would do it, that I'd be at peace with myself. And if you did it, you'd be at peace with yourself. And if everybody else did it, we'd be at peace and we would have no war. That was his, we'd have world peace. That was his overarching philosophy, right? Which is kind of cool. But with regard to specifics, I think, and this is purely the world according to McDonough, but if we look at the architecture, right, nothing is by accident in the body. The body is just an incredible piece of engineering. If we look at the architecture of the spine, so belly side, back side, what's available at the lumbar spine is mostly forward bending, then some back bending, then some side bending and rotation, and not a whole lot of rotation at all down low in the lumbar spine, right? And I think that's what, therefore, is addressed in the order in which you go through the exercises. Warm up and use your spinal flexors. Get more spinal flexion if you can, to the point that you can. Get those flexor muscles, those spinal flexor muscles, trunk flexors, we used to call them when I was in PT school, right? Get those turned on, and I think of them as emergency brakes. They're warmed up and ready to respond so that then you can safely do more extension without just banging into the end range of your joints. One of the other, and then before you do rotation and side bending, one of the other philosophical tenets of the method is two-way stretch and spinal decompression, joint decompression. So if you can find a way to not just bend where you can bend, and we see this all day long, probably in Pilates studios and yoga studios, people doing Cobra and banging up where they go and not getting this two-way stretch. Here's my favorite little dude, this two-way stretch of where you can go, supported by the flexors to safely work your extensors. So it's that sort of tensegrity model of getting more decompression of all your joints before you move into full range of motion in that. So I think that that's why there's a whole lot of flexion and then extension and then side bending rotation. There is always, and I love that you said, we teach the body in front of us and the patients tell us and show us what's necessary. Within the method, there's a lot of room to riff and figure out where you're going to go next. Do I need to be non-weight bearing? Do I need to restrict the range of motion? Do I need to make the resistance less by changing the levers or the resistance? So there's a ton of leeway within there, but that if you follow the method, it kind of gives you a framework that helps people feel decompressed, feel taller, feel better.
I love that explanation. Thank you so much for sharing with that, because I did notice a fair amount of flexion-based activities in Pilates. And what's particularly interesting is that if you look back at the early stages of physical therapy, right? People who had low back pain, sciatica stuff. We did a lot of that William flexion-based exercises, right? And not to say that didn't work, right? There's certainly a lot of people who actually benefited from it, and that's why the protocol is there, right? So when you were sharing this with me, 3 main principles kind of jumped out at me, which I think is really, really cool. Number 1, you talked about how there is a lot of flexion available in the lumbar spine. And so the first word, the principle that comes to mind is, I call it movement capacity. We have the capability for having these motions. And oftentimes, if we are not reaching that capacity, or when we're not reaching that budget, that often gets over budgeted into different motion. And the way that I describe it with my patients, whether it be flexion or extension, is I like to say, and you let me know if you agree with this, Kathleen, but I like to say with folks who, especially doing sciatica, being like, listen, flexion isn't bad, extension isn't bad, rotation and side bending isn't bad, but we all have a specific budget to how many times we are allowed to do it before our nervous system actually says, please stop, right? And so say, for example, if someone has a tendency to be hyperlordotic and you have a really large arch in your back, you're probably stuck in extension. And so your budget for back bends and extension is probably only going to be, say, 50 repetitions, right? Whereas your flexion-based standpoint, you might have 300 repetitions. But then if you look out throughout your day, every activity that we do, every exercise, will actually count down of those specific things. And so I really appreciate the recognition that the spine is in fact able to move. And do I think in some cases when people are experiencing acute pain and that they need to control motion? Absolutely. But if you are scared, if you're stiff, here's a huge opportunity to be able to start reintegrating movement. And what I really liked about the Pilates fashion was that, as you said, you can change it to the person, which allows you to be able to apply it in a way that will work for the patient who's sitting right in front of you, which probably one of the big reasons as to why working with an instructor or someone like yourself is actually particularly important versus just doing it on your own. So That's principle number one. Principle number two, talk about this tensegrity and biomechanics. Listeners, if you've listened to me before, I talk about how important it is to have efficient movement. When you have efficient movement, you minimize wear and tear, you generate a lot of power and a lot of force with less energy. And that's really the key. I really appreciate when you said if you can train those flexors, you can then go into extension in a safe way, because as Kathleen said, the spine is like, you have 5 lumbar vertebrae that is stacked on top of your pelvis, which is fused. And so even if 3 of those joints are tight, you could have an over motion at one specific joint, which will then wear down the specific moving capacity. And then the last piece is I really appreciate you talking about changing variables. I think, unfortunately, especially for our profession, a lot of times people are like, oh, you have sciatica pain, you have low back pain. Well, here's these 13 different exercises. And they're kind of, and even just changing that is really hard. And also, if you just do 13 straight exercises straight through, that means you have 13 or more variables that are actually impacting your pain. And so being able to change it is huge. So thank you, Kathleen, for making that clarification, because I don't think anyone, including myself, had an understanding of why is Pilates, the question is, why is Pilates? Yeah.
Yeah, that spinal decompression, joint decompression. How do we get here's another major tenet. How do we get all the little muscles working in service of the big muscles? That uniform development was a big thing with Joseph Pilates. It's like, we're not just going to work our big, strong muscles that look good. We're going to work the support muscles, the respiratory muscles, all the torso muscles that help keep us here and not here, resistant to gravity. And how we can then move with length and strength from the inside out, from our engine out to our periphery in a safer way. And to do that with good control and support so that your habits don't nick down all the little irritants that you were talking about. How many times a day are you going to bend over, and how are you doing it? And can we make that better and safer?
So let's take this method as a tool, right, and recognize that it's a tool that you can apply to your patients. Now, when a patient comes into your office, right, it's not like they go in and you say, all right, well, you have sciatica pain, we're going to go through this sciatica pain Pilates flow, right? And you see that a lot on YouTube. You'll see the Pilates flow on YouTube. You'll see a yoga flow on YouTube. You'll see all these different things. So when a patient comes in with sciatica, with low back pain, what are some of the things that you look for that help you make your specific decisions on what to provide for them?
Yeah, so everybody that comes in, I see a few clients that are just Pilates, but mostly I see patients that are seeing me for PT. We're integrating PT with Pilates and vice versa. And my hope is to get them well enough and well trained enough that they can go to community-based Pilates and continue or with their home program. But it first starts with an assessment of what's going on. And we know that sciatica is not one thing or one cause, right? I'm going my spine again. You can have somebody with active sciatica caused from an anterior element problem like an irritated disc, bulging disc, herniated disc, extruded disc, inflammation from the disc, which it can produce a whole lot of that. And that person might be sensitive to flexion. They might also be sensitive to extension. You have an extrusion sticking back there someplace in your spine that's in the way. That person may not tolerate an extension protocol. How many times do we see this? People come in and they're like, I tried some press-ups and it didn't work for me. It's like, well, it's because it's not available right now, right? So is it an anterior element problem or a posterior element problem that you have stenosis, that you have a facet irritation, that you have little spurs hanging out in that foraminal window where the nerve comes out that are not allowing you to comfortably or safely do extension? Or I should say not that you're uncomfortable because it is pushing on your sciatic nerve. So we can have any number of reasons for the sciatic irritation, right? And then what stage are they at? Is it acute? Is it subacute? Is it chronic? I see a lot of people that come in and they say, I got some exercises and I'm doing some flossing of my nerve and it's way too early. I see that. I don't know if you see that a lot, but it's like you have an irritated nerve. You are poking the bear every time you stretch it or do your nerve floss, right? Let's back off. Let that heal, stop the irritation before we go into it. And then there are specific things that we can do in Pilates to not irritate that If the exercise calls for you having a straight leg and you have an irritated sciatic nerve that is still hot and unhappy, we're not going to do that. We're going to modify that in a large way until it's comfortable for you. I hope I answered your question.
Yes, absolutely. I appreciate you. Yeah, I have no words, but the way that you described it was perfect, and it was. I highly agree, because you recognize that the nerve itself is a very long nerve, and because it's long, it can be influenced throughout any point at which that nerve can actually cross a specific junction. And I often actually tell people, I'll say, listen, your nerve actually starts in your brain. It goes down your spinal cord, down your neck, into your thoracic spine, down, and then it exits out. So already there's so many different pathways at which that nerve can be irritated. And then once the nerve roots actually exit out, right? Because listeners, I've talked about this before, the sciatic nerve is formed by the extended nerve roots of L4, L5, S1, S2, and S3. So that means that you have the convergence of, I think those are 4 nerves, the convergence of 4 nerves that actually exit the spine. And I actually just was recently working with a client, and we were talking about the level of healing potential. Because when you have, say, something more central, and this is why surgeries are so important, is that when you have a central lesion, like extremely herniated disc or an extruded disc, that's actually placing direct pressure on your spinal cord, yes, it does make sense for that to be removed, because any further irritation can lead to long-term permanent damage because it's addressing the spinal cord itself. But the moment that it actually exits the spine, it transitions to what is called a peripheral nerve. And a peripheral nerve, especially those nerve roots, those peripheral nerves have a high capacity to actually heal. And so I guess what I'm trying to say is that once we determine at what level is that nerve irritated, is it more centrally or is it more peripherally, it also gives us permission to add some specific things. And so I'm thinking, especially in the Pilates, and you let me know if you agree, in the Pilates application, you were talking about what are the possibilities for this person versus what can't they do, right?
Yeah.
And so that actually automatically opens the floodgates of possibilities. And oftentimes people who've been dealing with pain for such a long period of time, maybe their tissues are actually healed, but they are dealing with some central sensitization up here in the brain, right? Mm-hmm. And so I find, especially with what I'm learning right now, is that Pilates is a great way to introduce movement in a very low threatening way, which can actually recondition that brain to say it's safe to move. So do you ever see any of that stuff on your end?
Totally. And I was going to say that, Joseph Pilates didn't call his method the Pilates method. That came from others. He called it contrology, which sounds like Scientology, but it's not. And contrology, he said contrology is complete coordination of body, mind, and spirit. So it's about having control and recognizing and feeling what's going on in your body so that you can take appropriate care, right? So when we see somebody with a hot, irritated nerve root, we're going to treat them differently than somebody that has an old cold lesion on the exiting nerve root that is just scarred, that just is tight. And how many times do you say to your clients, especially like the one you described, you might feel a sensation in your back, in your leg, whatever. Leave room in your mind that this might be an okay thing, right? It may be your body calling for more information about that sensation, and you've had pain there before, but let's see how it behaves. And does it improve as we do this, or is this just yanking on something that doesn't feel good, right?
Yeah, and to piggyback off of that, it's important, especially as clinicians, and you probably do this with your patients too, but listeners, when you are working with a practitioner, when you're saying something doesn't feel great or you are feeling symptoms, what should be the response from that provider is, well, tell me a little bit more, describe it so they can get a better idea. Oftentimes, if I'm working with a patient and they're saying, oh, well, this feels strange, I would say, well, tell me, what does strange mean to you? And if it says, well, it's not reproducing the symptoms I'm talking about, then I'm thinking, all right, we might be able to proceed safely. But if it's, Ashley, when I do this, it reproduces my symptoms, okay, well, we probably should want to stay away from that. It's kind of like that hot button that we want to avoid for now. And so it certainly is important that, especially in rehab and you're working with someone like Kathleen or myself, pain relief is a two-way street. Because it's not just you come in and we give you exercises. It's you come in, you tell us how you feel. We do something, you tell us how that reacts, and then we change it off of that, which is again why it's so important to be working with someone versus having to do it all on your own, because you might not necessarily have the opportunity to clarify, what are you experiencing? Is this a good thing? Is this a bad thing? Does something need to be changed?
Yeah.
Yeah. So let's talk about the success. Pilates is a tool, manual therapy is a tool, stretching is a tool, even like the individual things of each activity, right? Like prone press-ups is a tool, standing back extensions is a tool, double knees to chest is a tool. So when it comes to tools, there's going to be some specific criteria that will indicate that whatever tool is being used is going to have a higher success rate. And so let's talk about Pilates as a tool itself. What are some of the criteria that patients or people should be looking for to help them recognize, oh, well, Pilates might actually be a good tool for me to use if applied properly? Because obviously tool needs to be applied appropriately.
Yeah, so I categorize not people, but their issue, their symptoms by what are they sensitive to? Are they sensitive to load? Are they sensitive to position like spinal flexion or spinal extension? Are they sensitive to static posture? So these are the people that say it doesn't really matter what I do, but if I do anything for more than 10 minutes, I'm not good. Or are they sensitive to direct pressure? And so taking that information and maybe ascertaining that information from the exam that we do, we can design a program that's going to be most appropriate. And lots of people are sensitive to load. Like we just sit too much, and so there's just an awful lot of load on our spine, and getting unloaded is a really good thing. So this is why people often feel better when they swim, or if people tell me I'm better with traction, I'm better with swimming, I'm better when I lie down. Okay, well, let's design your program in Pilates so that we're not sitting. Let's design your program so that you are laying down. Are you going to be lying down on your back or on your belly or on your side, and how much of each? So there's a whole lot of variability in how you do program design based upon that individual client. I think that one of the biggest things is you got, as a patient, as somebody seeking help, you have to seek out a qualified teacher. And unfortunately, in the Pilates world these days, there are a whole lot of people doing Pilates that are not necessarily qualified. We don't have licensure for Pilates practitioners in this country, and I'm not sure we should, but we do have a national certification program that you have to have graduated from a program, teacher training program of at least 450 hours in order to sit for the national exam. And the national exam I worked on for 10 years with the National Pilates Certification Board, and it is an absolutely legit, reliable, and repeatable exam. We work with psychometricians and pay them a fair amount of money to make sure that we're testing what we think we're testing, that it's a legitimate test, that there are no biases. So sitting for that kind of exam, I think is really a sign of a teacher who cares about projecting themselves as a professional, as a movement professional, right? You and I went to a graduate program for PT, but we still had to sit for state licensure, an independent third party, right? And that, I think, is really a sign of a good Pilates teacher. Well, I shouldn't say that. There are lots of good Pilates teachers that aren't certified, but it's a sign of a certain level of professionalism and trying to advance the profession, to make sure that healthcare professionals who might be referring to a Pilates professional know the difference between somebody who goes to a weekend course and somebody who's more serious about their Pilates education and has proven it with national certification, because healthcare people often don't, or that the public knows the difference, right? So, and if you go to a big mat class because you have back pain and somebody told you it's going to help you feel better, I'm almost willing to put money that it 100% is not. You're not going to understand the concepts. You're not going to know how to do the thing in your body. And it's very likely that you're going to get hurt because they're doing sometimes all 34 exercises without any modifications for you specifically. So if I can see a client beforehand and give them a few pointers and get to understand their specific situation and give them armament that they know this is how they take care of themselves in a class, then that's going to be a more successful situation. So finding a qualified teacher doesn't necessarily mean a PT, although sometimes that's helpful, especially if you still need treatment and incorporating Pilates. Finding a qualified teacher, doing some private lessons first before you jump into a class, and class size does matter. So these big, megaformer classes with 30 people in them can be cheap, but you get what you pay for. And it's not always a positive outcome when you do that, right? It's interesting when I have my Pilates teacher hat on or I have my PT hat on, where we start is the same stuff. So can you breathe correctly? Can you find a comfortable position for your, let's say, your lumbar spine? Can you keep it and then add leg movement or arm movement? Can you do a small upper abdominal curl and draw your belly towards your spine, cinch your entire corset, transverse abdominis, multifidus pelvic floor, without pain? Those skills are the same spine stabilization skills or Pilates movement fundamentals that are the building blocks that contribute to the bigger exercises. Starting there is really important, and unfortunately a lot of times people go, I want to do Pilates, I don't want to lie on the floor and breathe. Well, breathing is the first skill, and breathing correctly will help you have less pain if you're in pain and help you to move more correctly. And it was interesting during COVID when we were getting more interesting content online. I took some webinars from Mary Massery, who's a pulmonary PT, a pulmonary pediatric PT. Usually historically the pulmonary PT department's on one floor and ortho PT's on another floor, and they don't talk to each other, and there's not, right? Well, Mary really pointed out and made a great case for how respiratory muscles are postural muscles and postural muscles are respiratory muscles, right? If you can't breathe well, your posture is going to suck. And if your posture sucks, your breathing's probably not very good either, right? And therefore your exercise is not going to be very fruitful because you're not breathing in a way that helps support good form, good mechanics, a good outcome of doing whatever you're doing, right? So it's kind of interesting that it's like coming full circle after several decades of working in PT, that it's kind of comes to the same place, right?
Yeah, it's funny because if you look at even just from like a dosing standpoint across sports science, they're talking about like, it's funny because you can read the like NSCA, you can read all like the NASM, or even just like the rehab strength conditioning part of it, like all the science is the same. Like they all say the same stuff, which I think is useful to see. You brought up qualifications, certifications. What I've actually found, and you probably let me know if you agree with this, certifications and qualifications indicate that you do have a baseline level of knowledge, but it doesn't necessarily equate to being good at what you do. Mm-hmm. Right? I see that a lot even in the physical therapy realm. You'll have people who pass these boards, and listeners, people who pass their board exams, they just need to, like, the test itself says that you are not going to hurt nor kill a patient. That's the only standard that these exams do. Now, it's a very important standard to set. But once you get from there, the difference in quality is very wide. And so what are some of the qualities or things that the listener should be looking for to understand that whoever they're working with is going to be a good practitioner, is going to help them out specifically? I have some criteria, which I'll share after you share yours.
Well, I think national certifications, the National Pilates Certification Program lists qualified teachers who've passed the exam. It's a baseline. It's not, it's not like a master or whatever. It's a baseline that is for the protection of the public. The credential is Nationally Certified Pilates Teacher, NCPT, right? So if you find a Pilates teacher with those credentials, that's a good sign. I think it's a good place to start because you can say you are certified, but does that mean you took a weekend course, or does that mean that you took a year-long course or something in between there, right? So, and you can call yourself a master teacher with very little backup behind it, right? So I think looking for national certification is kind of a good thing. Going and meeting the teacher and making sure that it's somebody that you can relate to and that you like and you understand each other. Some teacher training programs don't require any anatomy or applied kinesiology, which I think is a big mistake because I think it adds to the quality of the work and the quality of the understanding the body that you're teaching. So, again, if they pass a national exam, they need to know some information about basic anatomy and kinesiology and precautions for certain conditions. How do we modify for somebody who's had a hip replacement or for back pain or any number of things? So I think that doing your homework and not just going where your teenage daughter goes because she goes to hot Pilates. Okay, I don't think that's a thing. I'm sorry. I don't think it's a thing. I don't think it's Pilates. But checking it out and seeing, it may be great for your teenage daughter because she can do all kinds of stuff that may be crazy, but is that safe for your body? I don't know. right? So do your homework before you just jump in. I think that becoming a Pilates teacher is a commitment of time and money. And so if you're looking for the cheapest thing, you're probably going to get the cheapest thing. And that may not be helpful for you. And the same goes with finding a personal trainer or a PT, right? Do your homework about who you are trusting your body to. I'm telling you, there are some crazy things I can do out there on the equipment. I can hang you from your feet and you could fall on your head, right? So you better have a teacher that understands that some of this stuff is kind of more appropriate for some and not for another, right?
100%. Yeah, I will add one of the things I find what's particularly important, especially when it comes to trying to manage your pain or even just treat your pain, is that the practitioner that you're working with should be able to communicate to you what is going on in your body in a way that you understand. Because if you go in and you just don't know what the heck you're doing, but you're just following through, it can be helpful. But one of the challenging things is if you don't quite get it, it becomes extremely challenging from a recovery standpoint. So in 100%, you want to have what we call the therapeutic alliance, where you and the person that you're working with are on the same page when it comes to getting you better. Kathleen, this was super eye-opening, and I appreciate all of the time that you've taken out of your day to break down Pilates and how it can be applied, and even telling us more about yourself. So for the listeners who are like, I think I want to get into Pilates, or I want to hear more from Kathleen, what is the best way to get in touch with you?
Well, you can go onto my website, which is kmcdonoughpt.com, KMCDONOUGH, P as in Paul, T as in Tom.com. And there's some information and some blogs on there. The website is just about to be flipped over to a new website, but it'll have the same way to get to it. You can email me at info@kmcdonoughpt.com. I have a YouTube channel that we took. I'm sure, Ashley, you do this too. Sometimes I find myself giving a lot of similar instructions that are basic spine hygiene, right? Like people should know that sitting at their desk in a slumpy executive chair on their computer all day is not going to be good for their back, right? So how do we give them ergonomic information, or how to bend your back without bending your back? Some safe mechanics, right? And so I wrote down about 20 different topics of things that I say to people all the time, and it makes me crazy that it's not common knowledge. And we took them and put them into small bites into the YouTube channel. So if you look up K McDonough PT or Kathleen McDonough on YouTube, they're short little snippets and they're useful information. And if they're not useful information, they don't resonate with you, or you're like, that's not really what my PT told me, skip it. It maybe isn't for you, right? But there's a lot of good information on there. And then I'm also on Instagram and make some posts from time to time. So I'm happy to chat more or answer more questions for anybody.
Awesome, listeners. If you did not get a chance to write that down, I'm actually going to be putting all that contact information into the show notes. Kathleen, again, thank you so much.
Thank you.
It's so fun sharing your knowledge with the world.
Thank you. And I'm so happy that I met you and that we get to see each other down at the gym. And awesome stuff. Thank you for asking me here.
Thank you so much for tuning in. We hope you got some help from today's podcast. And for more info, check us out at ifixyoursciatica.com. Have a fantastic and pain-free day. No patient-therapist relationship is formed by listening to this podcast. We are not providing medical advice, and all information should be confirmed by a medical provider.